Now, there's another very important surgery which we try to look at it. And most of the times when you hear them talking about this surgery, you usually see them abbreviating it. So they usually abbreviate it as what? ERCP. You mostly just see it ERCP like that. So ERCP simply means what? Endoscopic retrograde cholangiopancreatography. Endoscopic retrograde cholangiopancreatography. Alright, so you see this is it. And usually it's a procedure that is used to what? Remove gallstones. Right? It's a procedure that I'm actually doing to remove gallstones. Right? Probably there's a blockage in the bile duct, so I'm actually doing this to like relieve it, you know. So what it means, the endoscopic retrograde cholangiopancreatography is a specialized procedure, and they use what? Endoscopy and X-ray to diagnose bile ducts, gallstones, and they also, as you diagnose, you confirm, you also remove. Do you understand? So you could say that this kind of thing is what? Both diagnostic and also both therapeutic. So it's a flexible endoscopic tube. They put it through the mouth into the stomach and the duodenum. So a catheter is now inserted into the bile or pancreatic duct. So the contrast dye is injected and X-rays are taken to visualize the duct. So if needed, that means if you see that there's a big issue, you can now solve it by removing, and all of that. All right. So that's what we got. So clinical usage is basically for diagnosis. So they dictate gallstones, strictures, and tumors. They evaluate probably what is causing jaundice or what is causing pancreatitis. So they can now be able to remove the bile duct stones, and they can also, if there's some stricture, they can place some stents that will just keep that part open so that things are passing and there's no blockage. They can also dilate what? Narrowed ducts. Okay, and also treat leaks. Advantages: provide visualization. You can see and you can treat. Can relieve obstructions immediately. So risk is it can lead to pancreatitis, bleeding and infection. So you have to keep it as an aseptic what procedure. Requires sedation and what anesthesia. So basically this is what we have for this procedure and its application.